So I want to go over a little bit about what we're doing here. So I reached out to a lot of pulmonary rehab programs, and a lot of you showed some interest. So I'm going to go through a little bit about what this program is all about. This program is really designed for pulmonary rehab programs to obtain better continuity with their patients. So as many of you already know, it's very difficult to get people there on a consistent basis. We live in the Northeast, and so we deal with winters, high copays, ride accessibility. There's a lot of reasons why people can't get to rehab on a regular basis. So this helps to bridge the gap with those patients so they can continue with their exercise progression while on program for pulmonary rehab. And it's actually also designed for when people are done with rehab that they still have something that they can continue to do on a regular basis. So this tutorial goes through a little bit about how to sign up and how the program works, and just to show you the easeability of this whole thing. So when you first sign up, we'll do simple email. Okay. They can make their own password. This is really designed for people that, that one's already been used. Really designed for people that that aren't completely familiar with computers, and would need a little bit extra guidance with things. So so we're just going to kind of go through here. Currently we only have a pulmonary rehab, but we will have cardiac. So we're just going to pick this. And then we're going to go through a series of questions. And the reason for these questions is that it helps to identify patients and where their balance is, and to identify which part of the program is best suited for them. So it goes through a bunch of checklists, and we'll go through all of these currently, and I'll kind of wrap it up at the end of the questionnaires of why it's important. So we're just getting an age range. As far as like getting patient information, the only thing we have is their name. We don't look for a date of birth or any other identifiers. So it is all, HIPAA compliant. We don't have to worry about HIPAA because there's not enough identifiers. Checklist for their balance. Sometimes they feel unsteady. I'm worried about falling. They would check off, all of these that would apply, let's say. This is a modified dyspnea scale. So essentially a scale from 0 to 5, but it's worded so the patient can pick which one they have most breathlessness with. So only with strenuous activity, and they can only choose one of these because it helps to identify how short of breath they really are. Just to identify like the program that they're coming to, just so we can track who's using what. Pulmonary rehab, how many times they're coming to rehab. Let's say they're coming twice a week. Are they on oxygen? How easy are stairs, or how difficult are they? Do they use a cane or a walker? And then this is our physical assessment. So we're looking at a sit to stand test. This test really helps to identify where patients, physical capabilities are. So it shows a little tutorial here. It goes through a video of an actual 30-second sit to stand. Gives them a little bit of visual feedback on what they should be doing. It goes through the information up here where the chair has to be 17 inches from the floor. The hands have to be crossed, feet flat, and then they just perform the test for 30 seconds. When they're all done watching the video, then they begin the test themselves. If they need to, they can go and hit the back button. It goes for 30 seconds. And at the end of 30 seconds, you can end it early if you want. It's going to ask how many you did. And so with the information in the beginning of their age range, there's normal values for how many sit to stands they can do for a particular age. And this is the really cool part of the program. It helps to identify with all that information what category they best fit into. And so now they develop a home screen where it gives them some different information. And this is really where, it gets interesting because they have a weekly program that they go through that's always here. Okay. They have access to, little information tidbits about pulmonary rehab and, what's important, kind of a tip of the day. Courses pertaining to, all the things that pulmonary rehab teaches: COPD, depression, emphysema exercise, the importance of influenza, smoking. So, and then here are some exercises that best suit for an easy category that the program had figured out for them. And what's cool about this is you just hit today's starting program. So they'd have to log into this every day. Not every day is going to be filled with exercise, because if they're coming to rehab for a couple days, then they would, take a break for that, but maybe have like a course that they would see for that time. So just, doing that, you would see that there's 3 exercises. We'll probably have 4 to 5. And then they would just start with, one of these exercises. So it gives a little tutorial of what they should be doing. It gives them a counter, and they have to get at least 90% of the course for it to count. So it gives them a little countdown and shows a completion. If they want to do it again, they can. They can do up to 3 reps, or they can do as many as they want. Okay. If they're new to exercise or just have a difficult time with this particular one, they would say done, give a little feedback. And what's important about this is, if they really like it, it'll pop up back later down the road in later weeks. So it really mixes the exercises up, so it's not the same thing all the time. And so now that shows that that's completed. So after all 3 of these completed, it'll show like a success for that day. The other thing they do is going through, they have access to a library of all of these exercises, which we will continue to grow with, other stuff like yoga and, more stretching, maybe some Tai Chi. So we're going to get a lot more in there. Cycling. There's a cycling program for people that have a stationary bike at home. There's a whole bunch of stuff that they have access to, and it's separated into, easy, medium, and hard, which is identified for them, going through that assessment in the beginning. The education is also a huge part of it. So, if the patient goes through and needs to have certain things that, applies to their health. So if they have COPD, they should probably go see the COPD lecture. And you can prescribe these for the patients. There's a checkoff list and say, okay, I want you to go through this. I want you to go through the anatomy. I want you to go through, the benefits of exercise. If they're a smoker, you want to make sure that they go through that tutorial. So when they click on one of these, it'll shows a little PowerPoint video, anywhere between, 10 to 15 minutes. They go through this tutorial. So it really goes over, so many different things as it pertains to whatever topic they're going through. And at the end of the video, there's a little 5-question quiz. So now it becomes a competency. So now they have to answer those questions, and they'll get a little certificate. What they do is print off that certificate. They bring it into your program and identifies that they have been comped out in that particular area, satisfying the needs for, the pulmonary rehab program, or if you're certified through AACBPR. So that's what's nice about this. So it does really check all the boxes for that. So this program is really good for pulmonary rehabs. We're just going to start rolling it out in the next month here, and people, I think will really benefit from it. Just some of the trial patients that we've used this with have really learned to love the program. They're adamant. They love doing these exercises. They love to have some guidance that they can do at home. And these exercises are really designed for pulmonary because it helps open the rib cage up. It coordinates their breathing with the exercise. And, patients really learned with both increasing strength and then energy conservation when they're doing the exercises because they really get the best benefit from the coordination with the breathing and whatever their exercise they're doing. So there's a lot to offer. It is growing. It's getting bigger. Every week we're adding more exercises and education onto it. And if you have any questions, please feel free to reach out. Thanks so much for listening.